Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we're going to talk about dark under eye circles, a favorite topic for many people. This is a very common complaint at many office visits for many people. People just hate their dark under eye circles, and everybody thinks it's a problem for them and nobody has a good solution. But the thing is, out of all the patients that complain about their dark under eye circles, which is many, very few of them actually have dark circles, hyperpigmentation, and darkness of the skin. So today, I would like to discuss dark under eye circles, what can cause them, what also can mimic them, and then, of course, what we can do about them. When people complain about dark under eye circles, the most common situation that I encounter is patients who just have normal under eye skin. And the under eye skin is thinner than all the other skin on the body, and often you can see the blood vessels and the muscle underneath the skin, and that is what makes it look darker. The skin itself is normal, it's just thin, and it gets thinner with age. Another situation that I encounter is when some patients see a shadow that is being cast by an under eye bag or a fat pocket that they think is a dark circle. Again, the skin is normal, it's just that there is a protrusion of a little fat pouch underneath the eye, and that casts a shadow below, and as it blocks light from above, when it's big enough, it may mimic a dark circle. The third group of patients are in the small minority that actually have hyperpigmentation of their skin. And this can be genetic or from allergies or irritation or an unknown cause, but the skin under the eye and sometimes the whole eyelid is darker than the rest of the face. Sadly and lastly, another reason that people have dark under eye circles is due to bad filler placement. It has been very popular in the last decade or so to place fillers such as Juvederm or Restylane or other fillers underneath the eye in the effort to make people less hollow and potentially reduce the darkness that they see from the muscle. However, this treatment is often done poorly, and if that is the case, it can cause blue-green, hyperpigmented, swollen bags to develop that look unnatural. This is due to the light reflecting off the filler. This is otherwise known as the Tyndall effect, and it routinely amazes me that patients do not often connect the dark under eye circle with the filler. But I've often removed filler for people under these circumstances, and voila, the hyperpigmentation is resolved. I'm not a giant fan of under eye filler for this reason because I see this problem so often. But I'd like to digress for a moment and discuss another aspect of this filler and hyperpigmentation issue, which is that patients often also say that they are hollow when they are complaining about dark under eye circles, but they are not actually usually hollow. Somehow the media and the beauty industrial complex, for lack of a better term, have convinced many people that they have a problem that they actually do not have. This is my opinion. Some hollowing is normal. If the hollowing gets excessive, it can be addressed with either fat injections of the patient's own fat or fillers, but it is not the majority of people who need these interventions. And yet, many of them end up getting under eye filler. I guess we can also lay part of the blame on the injectors who are not choosing appropriate patients for under eye filler. So between patients asking for something that they don't need, poor patient selection, and poor filler placement, many of the fillers can cause the swelling and hyperpigmentation because the patient was not hollow and should have never had the fillers to begin with. The truth is, many of these patients really just had a normal under eye and needed a little bit of cover-up or foundation if they preferred it. But good news, if the problem is from filler, it is usually reversible because we can dissolve the filler. So back to the 4 reasons that patients think that they have a dark under eye circle. For the first patient where their under eye is normal, I try to reassure them and recommend a moisturizing eye cream of whatever variety they like Sometimes basic Vaseline or coconut oil at night is a good choice if you don't want a fancy cream. We always want to keep the skin healthy and moist because dry skin can get irritated and then a dark circle could develop. I recommend just using cover-up or foundation that matches the color of the skin to make it look less dark. I will say that people often do not like this solution, but this is what I do for my own eyelids, and I always say that when you see hundreds and thousands of advertised creams for dark under-eye circles, it is because none of them truly work. If any of them truly worked and fixed the issue, then everybody would use that cream. For the second group of patients who have an under-eye bag, they are often just relieved to understand what the issue is. But with our current technology, the only way to fix this is with surgery, and I recommend getting 2 to 3 opinions from great board-certified plastic or oculoplastic surgeons and discussing it with them. I can say that if the surgery is done well, there is no scarring since they suck out the fat pocket from the inside, and it is not typically a surgery that needs to be repeated later in life. It's usually one and done. This is, however, outside of my area of expertise. I am a board-certified dermatologist, and I defer to the plastic surgeons for this. The third group of patients have true hyperpigmentation, and we need to try to figure out the cause. Often they have allergies or eczema, they rub their eyes a lot, and the underlying issue must be treated. Once the underlying issue is treated, or if they just have genetic hyperpigmentation of their skin with no underlying issue, I will often then treat with a variety of fading creams and also chemical peels. Chemicals that work well to help fade pigmentation are retinoids like retinol or retin-A, glycolic acid, vitamin C, etc. There's a whole podcast on hyperpigmentation if you'd like to listen to that. But we have to be very, very careful with these chemical creams underneath the eyes because they can be very irritating, and also retinoids can thin the skin, and so it is possible that we could make the problem worse. So I monitor these patients very carefully. We use creams very gingerly, and I often do some chemical peels. These patients are usually improved significantly, and they are very thankful. The fourth group, which is patients that just have bad filler, and that is what is causing their hyperpigmentation, it's easy for me to fix, assuming it's a reversible hyaluronic acid filler, like Juvederm or Restylane, which it usually is. I can just do an enzyme injection that dissolves the filler. This can take more than one treatment. The injection can cause bruising. However, sometimes it's hard to get the patient to understand that the problem is actually the filler and have them be willing to remove it. Many patients like the fullness under the eye from the filler, and once they understand it's just the filler causing the discoloration and hyperpigmentation, they are willing to just live with it and use a little bit of cover-up, which is also a perfectly fine solution. So in summary, dark under-eye circles are a very common complaint, and I group this issue into 4 types of patients. First are patients with normal under-eye thin skin with visible vessels and muscle, which looks better with good creams and makeup. Second are patients with under-eye bags, which tend to be genetic and are only fixed with surgery. Third are patients who have true hyperpigmentation and darkening of the skin due to either irritation, allergies, eczema, or just genetically darker skin around the eyes. And these patients are made better by treatment of the underlying condition if there is one, and then fading creams and peels under a doctor's supervision. Fourth is hyperpigmentation from fillers that can often be reversed or just covered with makeup. I hope that is helpful for thinking about why people get dark under-eye circles and what can be done about them. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.